Did you ever wonder how efficient, or maybe we should say inefficient, the typical T-type pneumatic nebulizer really is? In this presentation, you'll learn about a radioactive tracer technique that was used to great advantage by an RCP, Michael McPeck, to ascertain the relative efficacy of 9 brands and models of pneumatic nebulizer. It's not unlikely that one of them is the very unit that your department stocks. Oftentimes, when we read a monograph in a peer-reviewed journal, data is presented in terms of the mean value or the standard deviation, or SD. We need to know what these statistical terms mean as they relate to clinical studies, and you'll be presented with a straightforward and diagrammatic explanation of these concepts, culminating in a coherent explanation of the so-called 95% confidence band. This module examines the seminal work of Dr. Newton Brackett and his research teams, revealing how their findings can allow us to discriminate between acute, chronic, and acute on chronic hypercapnia at the bedside. It is crucially important to do this, of course, in order that we select the correct therapeutic approach, aggressive, conservative, or wait and see, respectively, to the patient who's a CO2 retainer. If you're summoned to the emergency department to evaluate a profoundly hypoxemic patient, are you equipped with sufficient knowledge to meaningfully contribute to the decisions that the emergency medicine physician has to make? Can you advise her or him what needs to be done in order to identify and treat a patient whose hypoxemia is attributable to ventilation perfusion mismatching as opposed to shunting? You'll be provided with the tools to do that here, and even be provided access to tools that can be implemented on that specific patient to verify the type of disorder which elicited the episode of hypoxemia that triggered the patient's visit to the ED. On the other hand, suppose you've been assigned to the ICU and a differential diagnosis of ARDS is being entertained for a newly admitted patient. Are you thoroughly familiar with the Berlin definition of ARDS? It's a centrally important tool for the evidence-based characterization of hypoxemic patients. In this module, you'll be provided with a method for accessing a clinical decision support tool that will enable your ICU team to quickly and unequivocally categorize your patient's condition as being compatible with no, mild, moderate, or severe ARDS. You'll also be able to follow the patient over the entire duration of his or her subsequent ICU course. The material incorporated in this presentation will enhance the evidence-based practice of your entire team and will consolidate your role as a contributing member of that team.